Okay, let's try this again. Hi, everybody. I'm Dr. Prabakar. Good morning. I hope you guys are having a wonderful Wednesday morning. I'm excited to have a special guest on today, Dr. Amber Robbins, and I am just waiting for her to join. Great. So let's see. I'm just going to invite her to. And oh, all right. It
Hi,
worked.
it worked.
Hello. Yes. Thank you so much for coming on, Dr. Robbins. I know we've been trying to get this off the ground for a long time. So
Yeah.
I'm glad that finally worked. How are you doing?
I'm doing great. Can you hear me okay? I just want to make
Yes.
sure.
Yes,
Okay.
I can hear you just fine. Perfect.
Yes, I'm doing
Um,
great. I'm glad that we're able to get on. Yeah, I didn't realize how hard sometimes it is and how busy our schedules are, where
yes.
it
Yes.
can make it difficult. But yeah,
It
we're making it happen today.
We're making it happen today. Yes, so that's great. So I'm going to do a brief introduction and then I'll let you say more. So Dr. Amber Robbins is a family medicine doctor who went to college in Louisiana and then went to medical school and residency in upstate New York at the University of Rochester. And then I know she did another kind of a fellowship in media at Georgetown, I believe, right? Was
Yes,
it?
that's
Yes.
right.
Okay. And I know you're right now really vested in women's health, and so we'll talk a little bit more about that. So why don't you say a little bit more about yourself in terms of an
Mhm.
introduction? Anything else that you'd like to add on?
Yes, I love to tell people, even though I live in upstate New York and I've been on the East Coast, I'm actually from the South. I'm from
Oh,
Louisiana.
okay.
And so yes, I'm born and bred there. And I love to make sure that people feel included. So I do quite a bit of work with diversity, equity, and inclusion. I actually was on a meeting just now about that. But yeah, I also venture out and do things that I'm kind of going through my bucket list of things to do. So I recently just launched Sanctuary MD, which is a period panty, and that women can use, and you can put any type of pad inside it, and it stays in place, and it's leak resistant. And then also, I love to educate women on women's health. So we do that through
That's
Sanctuary MD as well. So yeah, I'm kind of
awesome.
like live life. You gotta
Yeah,
experience different things, do different things, you learn a lot along the way, and meet interesting people along the way too, just like you.
absolutely. Yeah, that sounds so great. And currently, in for practice, you're in Virginia, is that right?
I'm not in Virginia anymore. I
Oh,
moved.
oh,
I
you
moved
moved.
back to
Okay.
upstate New York. Oh,
Oh, okay, got it. Okay.
so I'm back
You
in
couldn't get enough of the
Rochester.
cold.
I know, right? Now it's really nice, but in the
But
winter
yeah,
it can
it's
be
yeah.
rough.
I grew up in Connecticut, so I get it. Yeah.
Yeah, well,
So
you ran
yeah,
away because now you're in California or in the
I
West
ran away to
Coast.
California, but yes, the East Coast summers are awesome. So enjoy it while it lasts.
Yeah.
So that's awesome. Okay, so we were kind of talking, we started this conversation last month when we were discussing, it was Fibroid Awareness Month in July, and I was looking to speak about things, associated with fibroids and heavy bleeding, and that's sort of how we started connecting. And you
Hmm.
mentioned this term, period poverty, that you educate women on period poverty, and that's something that you work on. And I was like, oh, that's actually a term I've never heard of. So can you tell us a little bit about what that means?
Yes. So it's interesting because, both of us are in medicine. And literally, I never heard about period poverty until I got into the space of looking at period panties and what we do to help women. And so, period poverty is really not having access to period products. And
Mm,
even with that access, thinking about going further of, okay, period products actually have taxes for them compared to men's products like condoms and things like that. They don't have a tax with it. So you hear about the period tax connected with period poverty. So I didn't think anything about it or think anything of it before I started to really see that there was a movement that started several years ago on period
mm,
poverty and trying to provide period products, especially within the schools. and also within homeless shelters or prisons. And so they have different organizations who are able to focus on that. But I felt kind of bad because as a family doctor, it's like, oh, you should know about that. And
Well,
as a
as an OBGYN,
woman,
I should know about that. I mean, certainly in practice, we hear about it all the time, but that term period poverty is so crucial, because we know that, I mean, these products aren't cheap, right? Like tampons and
mm,
pads, and for those who bleed a lot, especially in my field with fibroids, I mean, they're bleeding all month and they're using 4 or 5 pads a day. I mean, that's a whole pack in a couple of days.
yes.
So that really adds
Mm.
up. Do you have any numbers by any chance, like how much like an average woman spends on the stuff? Has
Oh,
anyone done any
well,
calculations on that? I
yeah.
wonder.
I actually don't have that number. I can come back with that number.
Yeah,
But I
I was
know
just kind of,
personally, because personally, yeah, that's how we connect too. Because personally, I have fibroids too. So I'm one of those women who use a lot of pads.
yes,
So sometimes it's just like, I don't even sometimes even look at how much. I'm like, this is a necessity. I need this. So
right,
I gotta just do what I
right,
gotta do. But everyone isn't in that same boat.
right.
But yeah, I will have to get back to you on the
Yeah,
average
no, I'm
cost.
sure somebody's done, like, an average, if you
Yeah.
think about it. I mean, every 12, for every month, for 12 months, a year, the average
Mm-hmm.
woman. And then, as you said, people with periods or just other bleeding disorders, or, other menstrual issues, who tend to bleed a lot more, are using a lot more of that. And we're privileged, so that, I, like you, I also don't look at like the bill every time, I buy something like that. But it can get expensive for those who really
Mm-hmm.
can't afford these products, or really to budget it in to their,
Mm-hmm.
to their budget every month.
Yeah,
So
especially when you want products that work well. When you're a
yes,
heavy bleeder, you know how it feels to be embarrassed when you have that leak and then be in the middle of your workday or middle of doing something and it happens. And so you want to have the right support there. But even with the pads, sometimes you still have those leaks, and that's why I created the period panty because I was like I cannot
yeah,
afford these leaks while I'm trying to work and
yes,
get things done. So yeah, it can be very costly, and then costly financially, and then also costly. I don't know if people still have this where they kind of sneak and buy the products and kind of feel ashamed
yeah,
when you buy period products too. There's still a lot of that going on.
right,
So people don't
right.
even know how to use them correctly. So all of those things, I mean, kind of go through the whole spectrum of period poverty, not knowing and having the education on
Yes,
what is appropriate use of period
r-
products too.
right, right. So, tell us a little bit more about this product that you've designed, and kind of Sanctuary MD.
Yes, yes. So I'm excited about it because I have used this product during my pregnancy. Okay.
Ah,
It has brought me, and so right now I'm 30 weeks pregnant, and so
oh,
I
yay!
yes.
Congrats!
So you've been experiencing some of my pregnancy brain too. So I
Oh
apologize because she didn't know I was pregnant. Um, but yes, so I had some issues with my fibroid during my pregnancy,
yeah.
and had some bleeding during my pregnancy as well,
Mm,
and so I'm higher risk. But anyway, the product I initially thought of when I was in medical school because I know I was really having heavier periods, and I think that probably was due to more stress,
mm-hmm,
and so and fibroids getting bigger, and aging and
mm-hmm.
all of those things. So I wanted to find something that was on the market that would help me still wear a pad, but still give me the confidence and the coverage that I needed. And so a lot of the products on the market, they like Things or Next, they were
Yep.
good in regards to okay, it gives you that leak resistance, but it really didn't have anywhere to put a pad. And if you have heavy periods, you know that sometimes your period goes on a little longer than you would want to. So you're wearing a pad all the time. And I used to get frustrated with the wings that used to come out the dark panties. And so I wanted to be able to create something where I could tuck in the wings of the
Mm,
pads into my panty. I could be reassured that things would stay in place. So my period product, my panty has two straps, one strap at the top of the panty, one strap at the bottom, and then it has a peep through where you can put your actual you can put the actual pad wing. So things stay in place. And if it doesn't stay in place, there's two layers. So you know how your panty usually has a bottom, it has a layer that goes in between your legs. It's called the gusset. It has two gussets. So both of them are leak resistant. So whether you move a little bit at the, your top gusset can kind of move with you. And then the bottom one is also leak resistant. So it has you protected, and it has a wider gusset there as well. Because sometimes our panties can be like, they can kind of show a little bit and shift and all those type of things. So we made sure to make a product that didn't do that. So so it was all about,
exciting.
I got a heavy period.
Yeah.
I'm wearing these scrubs, and I leaked through my scrubs too when I was in residency. So I was like, there has to be something better. So I created it myself.
You go, girl. That's awesome. This is great. I'm learning so much today. I didn't know that thing was called a gusset.
Oh yeah, I didn't either until I did research and I learned. But you know what? The thing is, we see patients all the time. We hear what they go through. We hear what information that they may need and what products they may need. So who better than to create a product than the people who are taking care of them? I think of it as like a medical, even like a medical tool, just to really help. So
as you said, it's not just the financial, it's the social, it's the embarrassment, you leak through your scrubs, your pants, you got to go change, and if you're actually not wearing scrubs that can just be washed, you have to go dry clean your other pants, leave work early, get out of meetings, all of those things that women tell me that that's a huge social impact as well for them. So that is so great. Now pivoting a little bit into fibroids and pregnancy, you had mentioned that you were having a little bit of bleeding too in pregnancy. What are some of the other, kind of risks that have been described in terms of pregnancy and fibroids to you?
Yeah, so I am still going through this process. So I'm interested to see what, once the baby comes and everything, how things go. For me, I knew I probably had fibroids before I got pregnant. I actually had an ultrasound before I got pregnant, and at that time they told me, I believe the fibroid was around 8 centimeters.
Okay.
I didn't think that, it may have been a good thing to actually consult maybe another OBGYN and discuss it being removed. But they, my doctors were saying, okay, it's safe still to get pregnant. You should be okay. Well, during the pregnancy, my fibroid has increased to 13 centimeters. And so in the beginning of the pregnancy, I had a lot of back pain. I know I'm already high risk being an African-American woman. And so I really and being in medicine, I really pushed to have a high risk doctor. Because I know that with those things, I just need to make sure that everything's taken care of. So I had quite a bit of pain at the beginning of my pregnancy, a lot of back pain. Because the fibroid is actually toward the back of the uterus.
Towards the back. Okay.
And eventually it got better. The fibroid stopped growing. Thank goodness.
Thank God. Yes.
But I did have bleeding. And so it kind of went back to, the feelings that I was having before with heavy bleeding, like, okay, in this case, will this kill me? Because I'm bleeding so much, having big clots as well, that I've never seen before, taking care of patients. I actually bled on the floor when I was taking care of my patients and had to go to the emergency room. So all of these things that you can't necessarily say it's from the fibroid. I'm pretty sure it influenced some of these things. But I just have to be very careful during my pregnancy.
Very careful. Yeah.
And so, for me, I'll probably have a C-section, even though some people say I might deliver before then. But I'm scheduled for a C-section. And so I think if I would have known a bit more, I may have taken some other steps. Definitely for future pregnancies, I was advised to have the fibroid removed. And
Yes.
so it just really kind of changes how you look at fertility
Yes.
altogether. Um, so, and it's different seeing it as a physician and
Yes.
having patients go through it, but then going through it yourself on a
Yes.
day-to-day basis, it
Yes.
caused a lot of anxiety for me.
Oh,
So,
absolutely. And it kind of stresses the importance of information and education, right? As
mm,
you said, you were like, oh, you knew you had a fibroid, but not really sure whether to take it or leave it, or at this point, who wants extra surgery or unnecessary surgery? No one,
right.
right? So, but yes, like, maybe depending on the size and the location, perhaps it would have been a good idea, or maybe for future pregnancy, certainly, as you said. So it goes by, even as physicians. I mean, if it's not our field, sometimes like we don't know, like, outside the uterus and ovaries and women's health, I don't know, think about some other fields sometimes. And it's even for me, it just stresses the importance of like really getting that information and educating, which, we also do for our patients at the same time, because there's so many patients too in similar situations where, they're like, oh, should I go for a second opinion? What other information can you give me? So it kind of stresses the importance of educating ourselves, finding reliable information, not just Googling things, but, finding other physicians' websites or YouTube channels, and really, going, finding out information, and basing your decisions on that. So, and then, well, I'm glad things are looking up, and things it stopped growing and
Mm.
everything. And are you getting frequent ultrasounds then as well for the
Yes.
growth? Yeah.
Well, so this is like a double-edged sword. Like there's one part like, oh, I gotta get ultrasound, but another part is it makes it fun because I get to
Yes.
see the baby on a regular basis
Yeah.
and see how
Yeah.
she's growing. Uh, so yeah, but every month I have to get an
Yeah.
ultrasound, a growth ultrasound, just to see, how
Yep.
she's doing, how she's growing, and she's growing really well.
That's
She's pushing
great.
things around in there, so
Yeah,
she's
she's
making
making the
room.
space that she needs.
Yes. Mhm.
So, wow, that is so exciting. Okay. And when is your due date?
October. So October 11th is when I'm
Okay.
scheduled for the C-section.
Okay.
So,
All right. Oh, that's so exciting. You're at the home stretch. Just, I mean,
mhm.
it's already August, so,
Yeah.
a few more weeks and you're there. So that's exciting. Now, so where can people find you to learn more about, the period panty, to learn more about some of the work that you're doing?
Yes. So you can find me on Instagram at Dr. Amber Robbins. And then you can also find more about Sanctuary MD at Sanctuary SANXTUARY yeah, underscore MD, or you can go to our website at sanctuarymd.com. So we will be coming out with some interesting things in the next couple of weeks. So I'm excited about that. But the main thing is I just want to help women feel better. At the end of the day, we go through
Yeah,
so many things. And with this period stuff, it's every month. So just trying to make sure that we're taken care of.
right. Yes, yes. Oh, great. So wonderful to have you on and hear about
Yeah,
like
thank
the
you.
exciting things that you're doing, and this period panty that you developed for women with heavy bleeding. Such a great tool, and hopefully will save women from embarrassment, and also having to launder and change clothes, and be able to have a better quality of life. That's what it comes down to. So thank you so much. For those who are listening, you can, Dr. Amber Robbins gave you her information. You can also find me at Instagram, The Fibroid Doc, and my YouTube channel, The Fibroid Doc, as well. Thank you, everyone, for joining. Are there any other last things you want to mention, Dr. Robbins?
Yeah, continue doing what you're doing. Continue doing what you're doing. It's definitely a topic that not many people cover and not many people talk
Yeah,
about. So being able to give that information to women so they're so empowered to make good decisions is so important. So thank you. Thank you for having me as well.
yes, you're welcome. I wish you a safe rest of the pregnancy, and we'll be in touch.
All right.
Okay, bye.
Bye.
Bye.